Exam-oriented teaching of quadriceps femoris muscle. Yes, what is expected? Enumerate quadriceps femoris muscles. Quadri means four. 1, 2, 3, 4. So rectus femoris, vastus lateralis, vastus medialis, and vastus intermediatus. These are four muscles. Now, exam is near and you are scared. How should I prepare quadriceps muscle? Yes, if you remember one muscle, yes, you can remember four muscles. How, I will tell you. What is common in that? Yes, what is common, question mark, is nerve supply. That is L2, 3, 4. So that is femoral nerve. So that is common for them. So what is common is nerve supply. Yes, you may get 1 mark for nerve supply. So what is common is the nerve supply L2, 3, 4. So that you have to remember. Now names of the muscles: rectus femoris, vastus lateralis, vastus medialis, and vastus intermediatus. Yes, another common thing for them is insertion. Insertion is on patella. So you have got another point, that is point number 2, that is insertion. So insertion is on patella. So nerve supply you have got insertion. Now what is action? The action of this muscle is extension of leg. They help in walking, running, and jumping. Action is extension of leg. They help in walking, running, and jumping. Now, yes, question about origin. Yes, origin you have to by heart, but I will tell you the trick. Rectus femoris has got two heads. One is straight head and one is reflected head. So rectus femoris, one head is straight head and one head is reflected head. So straight head arises from, that is most important, straight head arises from anterior inferior iliac spine. You may write down this point. And reflected head arises from upper margin of acetabulum. So origin you have to by heart or you have to remember. So straight head and rectus and reflected head. Now about vastus lateralis, vastus medialis, and vastus intermediatus. Easiest origin is vastus intermediatus, that is anterior and lateral surface of the femur. You can see this femur, anterior and lateral surface of femur, upper 1/4. So this is still till this point, it is the origin. Look at my thumb. So this point is the origin of rectus, origin of vastus intermediatus muscle. Now vastus lateralis and vastus medialis again is difficult, but I will tell you the trick. You can remember the word intertrochanteric line. So vastus lateralis and vastus medialis. So you have got four muscles origin. Now if you don't know the origin, don't give the paper blank. Just write the word attachment and write, yes, they are attached to the patella. Which part of patella? Base of patella. Which part of patella? Base of patella. Now some common sense you can apply. Vastus lateralis, look at my finger. Vastus lateralis is attached to the lateral aspect of patella and vastus medialis is attached to the medial aspect of patella. Yes, but and vastus intermediatus is also to the base of patella. Rectus femoris is also to the base of patella. So insertion you have got. So don't use the word insertion, write the word attachment. I'm a bit slow. Don't use the word insertion, write the word attachment. So attachment to the base of patella. Origin I already told you. Nerve supply L234, that is femoral nerve. Action, extension of leg, helping in walking, running, and jumping. So if exam is near and you are scared, how to remember quadriceps femoris? Quadri means four. So quadriceps femoris, in this one lecture you can remember quadriceps femoris. But what this lecture excludes, yes, every muscle as highlight. Yes, because if you write the highlight, now if you want to score the distinction, you have to write highlight of every muscle. For example, I will just give you one example. Highlight for rectus femoris. Yes, most important. Highlight for rectus femoris. It has straight head and reflected head. So two heads, straight head and reflected head. So two heads of rectus femoris. So this is highlight of muscle. Every muscle has a highlight. So if you want to secure a distinction, you can add up the information. But you have got nerve supply. I'll repeat, L2, 3, 4. Minimum you can write nerve supply. Minimum you can write action. Now, origin insertion, the words if you can't remember, you can use the word attachment. Attachment is patella, patella, patella and patella. Now which part of patella? Base of patella. And I have already told you specific details.